Last week I made a video about social anxiety disorder and I got a lot of questions about agoraphobia, which is a very different kind of disorder, but often is confused. So I thought I'd make this video. In this video we're talking about agoraphobia, which affects almost 2% of people. So it's pretty common if you think about it. And we're going to cover the symptoms, talk a little bit about the cause, but most importantly we'll talk also about the treatments available for agoraphobia. But before we get started, I just wanted to introduce myself. My name's Dr. Sil. I'm a junior doctor working in Sydney, Australia, and in my free time I like to make YouTube videos that help educate, empower, and inform people who are interested in or experience mental illnesses. So let's get into this week's video. So look, what is agoraphobia? Agoraphobia is essentially getting a sense of anxiety or panic that is triggered by certain places where you feel you cannot escape. The DSM, the Diagnostic and Statistical Manual, version 5, which is kind of the textbook that psychiatrists and mental health professionals use to diagnose mental disorders, it identifies 5 places which can trigger this kind of anxiety. So the 5 scenarios are: 1, public transport, okay? And that doesn't just mean buses and trains, it can also mean things like airplanes. Number 2, the second scenario is the open spaces, so being in an open park or a shopping mall. Number 3 is the enclosed spaces, so being in a shop, maybe at the movies, at the cinema, that kind of thing, you know, like an enclosed space. And number 4 is being in a line or around people, so if you're standing in a line or if you're at a concert or surrounded by a crowd, that kind of thing. And the 5th and final scenario is when you're just out of your home alone. So these are the kind of 5 scenarios where you can get this sense of anxiety or panic that happens. And obviously, if you've been in these places that have triggered this awful internal feeling of anxiety, you're going to behaviorally change what you do. You're going to avoid the places that make you feel bad. That just makes sense, right? But we'll talk a bit about the management later where you actually challenge that. But yeah, people often avoid these places. And it can be so significant actually that they'll change major things. It'll affect their function in life. They might quit their job, they might break up with a partner, they might do kind of quite drastic things just in order to not get this awful sense of anxiety in those scenarios I talked about. And the feelings can be so bad that it actually triggers a panic attack, which is this sense that you're going to die, that you're overwhelmed with emotion, and it's apparently one of the worst things you can feel. So in terms of the cause of agoraphobia, we don't fully understand it. In psychiatry and mental health, we often talk about the biopsychosocial model for understanding the causes. So the biological component of the cause of agoraphobia is thought to be kind of a hyperactive fight or flight response, so a lower threshold to activation, and some people might just be genetically predispositioned to that. The psychosocial causes, you're at increased risk of agoraphobia if you had trauma in your childhood, which could be watching a family member pass away, or it could be sexual assault or even interpersonal violence and that kind of thing. There's also, if you have an acute stressful life event, an increased risk of developing agoraphobia. And also if you have any problems with drugs or alcohol, that also increases your risk. Whether these are cause and effect, it's pretty hard to work out, but they're all interrelated. And of course, some people just get agoraphobia without any known predisposing risk factor, because sometimes that's just how the brain works, and it's really unfortunate. I thought now we'd just take a moment to talk about an example of someone who suffers from agoraphobia. So as an example, let's take Joan. Joan is a 50-year-old female who, when she's in a queue at a shopping center, she vomits. All right, she gets nausea and vomiting. And so she's really worried about this, and so she avoids going shopping. And the more she avoids going shopping, the more reinforced this fear of being in a line in a queue gets. So it's really strongly established in her mind that she connects being in a queue with vomiting, because maybe that happened to her before. And so you can imagine if that's how Joan would feel about being in line, she's not going to go to the shopping centers, and she's going to change her behavior. She's going to avoid certain things. Fortunately now there's online shopping, so Joan could just do that, and that would be a good workaround. But if you wanted to get at the core of agoraphobia, we should talk a little bit about the management. Now, the management of agoraphobia is mainly CBT, cognitive behavioral therapy, where you meet with a therapist and you challenge some of those really deeply rooted and established thought processes you have, those fears that you get. And you can also do systematic desensitization or graded exposure, where you basically take things that make you feel a 5 out of 10 anxiousness, and you just kind of do those things until the anxiety subsides, so that you realize that you desensitize to the anxiety, and then you do something a little bit more anxiety provoking and wait for that to desensitize. So for example, Joan, who doesn't like to wait in lines, at first you could maybe show her a picture of a queue and then ask her to imagine that she was in a queue and wait for the anxiety to subside with those tasks. Then you could just go in a controlled environment to a shop where there was no queue, and then maybe just add, one person in the queue. Maybe it's a friend, just so that it's someone she knows. And you just slowly grade it up until then by the end of the 10-week program or whatever it is, Joan can then go and wait in a queue with people in front and behind her, and she's got the kind of ability to do that. But of course, these days with queues, there's quite a lot of spacing because of COVID. You need to be 1.5 meters. So maybe even that would be helpful so that you're not feeling kind of claustrophobic because everyone's so far away. Now, usually CBT is used alone, but you can use it in conjunction with pharmacological options. Things like antidepressants, which also help with anxiety, can be used. Things like fluoxetine. There's also options like benzodiazepines. Now, benzos like Zoloft or lorazepam, these should be used short term. They're not long-term solutions. They're just to help you through the therapy session so that you can get to a point where you don't need them anymore and you can wean off. Because there are risks with things like benzodiazepines because they do have addictive properties and can increase your risk of falls and that kind of thing. So you need to be careful with how you manage the two, but they can be used in short-term therapy. So that's it. Agoraphobia can be a very disabling condition, but there's lots of people out there who suffer from it. So if you are a sufferer or know someone who is, make sure you connect online with other people on Facebook groups or whatever you like. It's important you know that you are not alone and that there are effective management options out there. In Australia, you can get a mental health care plan where you get 10 sessions with a therapist, subsidized or covered by the government. So if you have agoraphobia, I highly suggest you talk to a healthcare professional. Also, it's an important point to make that you can't diagnose yourself based off this video. You have to see a doctor or a mental health professional to establish a diagnosis. So this is to educate and empower, but it's not to diagnose, this video. All right? Okay, that's it, guys. If you'd like to support me in the channel, you can leave the video a like, you can subscribe to the channel, and you can consider joining me on Patreon. And the first 25 people who do that, I do a little one-on-one meet and greet call with. So think about it. Have an absolutely lovely day, guys. All right? See you in the next video.